Yeah, so I hope I get more viewers on this today. I've been having a little trouble getting traffic over to the YouTube, so maybe we'll see a switch up. Obviously, this is a weird time for everything, and it's going to be tough to gauge what the best network to do all this streaming stuff on is. So, yeah, okay, I guess just I'll get cracking on it. So there were 5 new cases reported um, in New Hampshire yesterday of COVID-19. None of them were in Hillsborough, so that's cool that we don't have to deal with that in our communities. NHPR is reporting that there's a steady supply chain, and the problem with stuff being on shelves has way more to do with the the process of delivering those or getting them transferred from their original locations to warehouses. So warehouses are having a problem getting restocked in time just because they're on limited staff and they're trying their best. It was announced that people who work in supermarkets in multiple states were they are now considered emergency workers, which is good, I guess. I feel like we probably should have considered these people emergency workers the whole time, but that's just my 2 cents on that. Shopping centers, particularly here in town, are Shaw's. I know is doing it. Are offering special hours for people who are at a higher risk, um, or higher risk pool people. If you don't want to deal with getting exposed or you're having problems with deliveries, although there's a bunch of services in town that are dealing with that. If you're having trouble with that or you can't wait, you got to get out. You can plan around these times to go if you want a little bit more safety. The DHHS office, New Hampshire Department of Health and Human Services offices are closed. That's it. It's done. You can only do online or by phone from here on out. So there's that. Recycling has been suspended at the Peterborough dump. So let's see here. Cardboard, paper, plastics, just throw it in with everything else. It doesn't have to be in a bag per se. You can just throw it loose in, but you do still have to get those Blue Town bags that are, you'd pick up at Shaw's or wherever. I don't know why I'm looking that way. At any rate, you still have to get those bags to dispose of them, but you know, I think metal and glass you're still disposing of the same way you normally would. That's not changing. We're still recycling those things in the previous fashion, but cardboard, paper, and plastics all in the trash from now on. Um, MCH is going to be adapting, and these are updates that are coming directly off of yesterday's whatchamacallit, select board meeting. Yeah, there we go. This is all stuff that came directly from the fire chief yesterday at the select board meeting. So MCH is going to be switching up their practices to deal with things. They said if you feel like you need to get tested, if you're showing symptoms or anything like that, to call your primary care first. If you don't have a primary care, they will set you up with one. So you just got to get in touch with them and start working that out. But you will be able to absolutely get the help you need. Let's see here. Conval started delivering lunch to students. They're working on sending lunch to every single student right now. Let's see here. Every student in the district. We've got nonprofits. The food pantry is starting drive-by service for people who are already qualified. You have to be currently qualified to receive stuff from the food pantry, but they will help you. Monday, Wednesday, and Friday, 9 to noon. They're working on setting up a way to get new people signed up. There's not one yet, but it's in the process, so there'll be more updates that'll come on that, likely directly from the town, so you can check the Town of Peterborough website and they'll have current updates there. I'm also going to do my best to get in touch with people and see if I can have folks come on and give me sort of their minute by minute deal, if that's something that's possible. This stream will likely happen a couple times a week now, probably around this same time. So I would say faithfully will be here Tuesdays and Thursdays. Be up here doing this stream. So yeah, I sure hope that that's something that I can sustain. Yeah, it's it's gonna be good stuff. I'm 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 optimistic about the amount of community help that's happening. Everybody's really chipping in to make sure that everybody's getting food. I think that's probably one of the biggest concerns that I can think of. Yeah, and I'm interested to see how things play out as we go into the warmer months here. Particularly because I know that Cornucopia Project is staying open. They're staying up to date. They're gonna keep open and keep going. I'm gonna try and talk to a bunch of people and get information on local farm stands, people that are growing themselves that have maybe more than they need. We'll try and get some sort of assembly of resources together so that folks can figure out where they can get some fresh produce. If you're concerned ultimately in the next several months that there's going to be problems with the safety of your supply chain, again, NHPR is reporting that there's no problem with the supply chain right now. That might be stocking levels, but we don't necessarily know the safety of the supply chain itself. So there's obviously something to be wary of right there. And as things move forward, it's going to be good for us to just try and keep it as local as possible. When it comes to all your food, really. I know for beans and stuff like that, it might be a challenge, but when it comes to produce, we do pretty all right up here, especially in the warmer months. I'm not too concerned. Yeah, we rely on a little bit of import during the winter time, clearly, but I mean, I've seen a lot of decent stock from local producers throughout spring and the summer and even in the fall. And I've even talked to Dave Zay about that before too. So he's weighed in on the fact that you can absolutely keep a lot of sourcing super local, which is going to be good as we're trying to contain this moving down the line. Let's see. There is a business portal on the Town of Peterborough website where you can if you're a business owner in town, you can let them know what your status is, and you can get that posted. So they're aggregating. I think Fire Chief said yesterday that they had Chief Walker said they had 25 businesses reporting in. So if you got a business, just let them know what's up with you. That's going to be super super key. Let's see here. Conval is going to be creating a team. The district, they're going to be creating a team surrounding this issue, so they'll be directly responding to this as things come out, and that'll be good to know that they're really on top of stuff. There was let's see here. I'll pull that clip up in a minute. I'll just hop over to some of the actual stuff here so that I can show everybody these things, the links that we'll have up in the description a little later today, so everybody can see that stuff. Okay. Alrighty, and there we go. Okay, so here is the update for yesterday from the state of New Hampshire. Here's the new positive cases. Notice we have a lot of increase in Rockingham County, Hillsborough remaining the same. Let's see. None upstate, which is, I guess, good for everybody up there that's feeling safe. But again, this is just what's been confirmed. This isn't by any stretch of the imagination final assessment of of how many people actually have this. And it's, there was discussion that it's gotten to community spread at this point, which, when we hit that level, it's like, what is a game, Pandemic, which has been reimagined any number of times. I think now that's called Plague Inc. But if you play that game, you'd know that this is just this is it. This is like, and I think, anybody that I talk to that understands or that talks about the severity of this situation grasps that's the way it is, because you think about it in terms of major events that occur in a certain succession, and there's just been enough of those events in a row now that we can kind of project that when people are saying, yeah, we could be in this for 12 to 18 months, we could be dealing with this really long term, that's something that's you got to grapple with. We got to be super, super real about that. So scroll down. Final thing here, we have the actual numbers. PHL stands for Public Health Laboratories, New Hampshire Public Health Laboratories. So we're at 44 persons with COVID-19. People with tests pending, there's 631. 1,420 people have been tested total, and there are 575 people being monitored. Now, let's see here, because there's a little bit more to this whole thing than yeah, there's a bit more to this whole situation that I think is important to note, and that's that talked about this a little bit yesterday, but we're doing a lot of private testing. When I say private testing, I mean like privately created testing. That's how this is being done right now. The CDC is not really chipping in the way that they need to right now. That's just the deal. It's super, super frustrating, but it's what it is. In large part because they've been very defunded. Now, what's happening is you'll see, if you go and you watch, and I'll show some clips from it a little bit, but there was the press conference today when they're talking about public and private partnership that's happening. And, that's occurring. You've got public and private partnership happening, and we're touting that as the reason why we're doing so well. That's happening in large part because nothing else is being done, and there are business owners that are concerned about the longevity of their business, and they want to act appropriately in the current climate, so they're making sure that they get out and do what they can to help out. But let's be clear about what their end goal is. Every business that's in this wants to stay alive right now. That's every business, whether you're a restaurant or you're a tech company, or everybody just wants to weather this. Now, there's a lot of industries that are already totally slashed and just messed up by this whole thing. And those are some of the ones that help employ the people that need jobs the most in this country, and the people that struggle the hardest. So those industries have already been slammed, but there's a bunch that sort of haven't been touched yet, and we're not really sure if they're going to get hit. And that could happen anytime now. So, every lab is trying to figure out a way to make money off this. This is like, we got to keep perspective on, just because this virus hit and that's all that everybody's talking about in the news right now, doesn't mean that all of the other problems didn't go away. To be clear, right now they're trying to pass a law through that was a bipartisan, proposed by, I believe it was Blumenthal and Lindsey Graham. So and they're more or less trying to undo end-to-end encryption, which just guts online privacy, utterly guts online privacy, and would give the government a whole lot of power to just do whatever they want invasively in terms of recording and looking at everything that we do privately online. There's no way for us to protect ourselves anymore if this legislation goes through. So this is stuff like this is what's being passed through the system right now while we're not looking, because we're worried about this virus, which we have a right to be worried about, and we absolutely should be concerned, because if anybody, I'll see if I can pull up the footage at some point here in a minute. There's some footage that someone took inside an Italian hospital, and I'll just pull that up in a moment when I get a chance. Before I go off on a huge tangent with it, I will switch over. We'll just sort of go over. This was on the town site. Got alrighty. So beginning March 23rd, all town departments will restrict public access to town facilities. The public is asked to call when there is business to conduct with any department that cannot be conducted online. Both phone list and directory of online services are available at the town website and the homepage on the website that we're looking at right now. Library, minimally staffed, doing curbside drop-off and pickup of borrowed items, and on-demand printing. So if you need printing services, you can go there. A lot of that stuff. Steels is now doing delivery of stationery too. So for any of your paper printing needs, anything like that, we between Steels and Library, they got you covered. Again, they talk about the changes that the recycling center has made. We went over that. Town clerk is asking business be conducted online. And governor's issued extended temporary plates there from March 1st now on to April 30th. So any inspections, non-urgent, postponed. All town services online. Call to schedule any appointments that you really absolutely have to have in person. You got to call and schedule it. You just got to talk to them first. That's how it is. Everything is pretty much shut down. It's real. It is very, very real. So I am going to show sort of, I want to put on a clip from yesterday's select board meeting. Let's see here. I just need to just get resized here. Okay. Sorry, folks, I don't have this quite queued up. It's been a little hectic, and I'm just kind of trying to jump around. I mean, this is, this is new stuff for me. A little bit, having to do it this frequently. Before when I was doing these streams, it was like once a week, and I'd have all this time to prepare and just really rack up on articles and plan out what I was gonna say, and now it's just the rapid fire nature of this is so intense that I'm a little bit scrappier, but I feel like I'm getting a little bit more confident on here too, so that's good. Alrighty, let's go. We've got this. I'm just gonna pop this up here. Get this going now. Yeah.
So what we are proposing is that no employee with a fever over 99.5 degrees be allowed to return to work.
Okay, so just really quick, this is Nicole McStay from the town. She's listing off some basic rules, and this is just stuff that it's guidelines. And I'm just gonna let her tell it. I think this is really important stuff for folks to hear, especially if you're. This is gonna apply to any workplace, regardless of what's going on. This isn't just food service or anything like that. So, just so we're clear on what we're looking at. So I'm just gonna, yeah. So there we go.
Those employees must stay home and contact their supervisors immediately. Any supervisor who learns that an employee has a fever over 99.5 degrees must inform the town administrator and deputy town administrator immediately. That employee must stay home until they are free of fever, signs of fever, or any other symptom for at least 24 hours without the use of fever-reducing or other symptom-altering medicines, such as cough suppressants. The employee shall call their supervisor for clearance before returning to work. Employees whose household includes a person who is sick with COVID-19 or other flu-like symptoms must stay home and contact their supervisor immediately. Employees are required to practice social distancing as much as possible. This includes avoiding riding in the same vehicle, sitting together during meal breaks, and working in close proximity. Requested and approved. And then there's a reference to Chapter 7 of the Employee Manual for that information on how to request. The additional time is intended to support such needs as securing long-term child care in response to school and daycare closures and securing elder care support. We understand that there, of course, is a bill that has made its way through the legislature and it's going to likely be signed and enacted very soon by the president that would allow that would require that all employers grant 80 hours of leave to full-time employees, or 2 weeks worth, and a prorated amount for part-time employees based on how much they typically work in a 2-week period. There's also some other restrictions and requirements as far as the use of that leave goes. It's been written into the text of the legislation. Once that is adopted, then that will obviously supersede anything that we have in place, and we'll just convert over to using that language. But for the time being, the language in this last paragraph is just what we're going to go with.
Okay.
Okay, great.
Well, I'll make a motion that we accept this emergency addendum to the employee manual.
Second. Okay, we have a motion from Karen Hatcher and a second from Bill Taylor. And any further discussion needed? I don't think so, right? Okay, so all in favor?
Aye.
Aye. So that's unanimous. Thank you for putting that together. And
Okay, so there you have it. They're essentially just saying, I think the main thing is that first little detail right there. That first detail about making sure that if you've got a temperature of 99.5 or higher, that's it. You're done. You can't go to work. It's over. It's all over at that point, and you got to call in, and your employer has to notify the town. This is a whole process, folks. It's what it's gonna be for a bit now. We're talking about getting that full period of time. They're saying right now. They're essentially going with whatever is already on the books in terms of dealing with this, and then as Nicole pointed out, we're just gonna sort of we're gonna switch the default, whatever that is, when the president decides to get it through or Congress decides to get it through. Right now, they're bouncing stuff back and forth, and we're talking about one-time payments of, I think, $1,200 or something like that, which is just Um, just not enough. That's just simply not enough. And I mean, Trump did speak today a little bit about the possibility of there being more payments further down the line. I mean, I think he's really trying to cover himself on it, if you ask me. And he's really just trying to cover his own ass about it, which makes sense given what's going on. But I mean, as we'll see in a minute, I don't know how great of a job he's doing on actually covering himself when it comes to not being a total bonehead about this stuff. I mean, it's pretty staggering. um, and you know, I guess I'm trying to decide if I want to just hop straight to that or if I want to do if there was anything else that I wanted to okay, yeah, here. Well, this I'll pop up on the screen really quick. We'll just talk about this. So this is the emergency order number 9. So this is emergency relief for the healthcare system. This is an emergency relief fund of $50 million to be provided in the form of grants or loans approved by the governor and the attorney general. This is everything has to be approved essentially by the state. You got to run it up the flagpole, but this is sort of, for anybody that's worried about how much our state government is doing right now in terms of funding, if you want to hear a real dollar amount, here it is. We've got just, I think this was issued yesterday, if not the day before. I don't have a precise date on this posting, but I think it was yesterday. At any rate, there's a lot of relief, and this goes along with the Small Business Association relief loans that went out. So we're staying pretty on top of it. Now. We'll zoom out for a minute and do a bigger picture thing, and I'm gonna do the I'll do this this thing from today, because this was just like, this is pretty bonkers. It's pretty silly. I guess I'll just have to let it speak for itself. So I've got this queued up so that the question, the question is sort of included, and we'll just let this roll. So this was literally 2 hours ago that this happened. So okay. And just so everybody knows, this is on the screen right now. This is Dr. Fauci. Dr. Anthony Fauci. He's one of the lead people on it, one of the main doctors, and he's answering questions here with Trump about what's happening, and this exchange gets interesting. Okay, so okay, let's just take a minute. So he's just saying that there was there's a drug that could potentially be used to alleviate things or help treat symptoms and whatnot that Dr. Fauci says we can't really expect much of it. So it's just this is our baseline. It's just here's how Trump deals with this. Okay, for some reason it looks like I lost my desktop audio here. Hold on for a second while I try and solve this problem. Yep. There we go. Okay. Try and back this up a little bit. Okay. Let's try this again, folks. So here we go.
Therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no, and the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
Mr. President, on that. On those therapies.
I think, without seeing too much, I'm probably more of a fan of that than maybe than anybody. But I'm a big fan, and we'll see what happens. And we all understand what the doctor said is 100% correct. It's early, but I've seen things that are impressive, and we'll see. We're going to know soon. We're going to know soon, including safety. But when you get that safety, this has been prescribed for many years for people to combat malaria, which was a big problem, and it's very effective. It's a strong drug. So we'll see.
Fairly effective against SARS.
It was, as I understand that, is that a correct statement? It was fairly effective on SARS.
John, you've got to be careful when you say fairly effective. It was never done in a clinical trial. They compared it to anything. It was given to individuals and felt that maybe it worked. So
Was there anything to compare it to?
well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care plus the agent you're evaluating. That's the reason why we showed back in Ebola why particular interventions worked.
Sir, on that topic. Mr. President. About the possible therapies, yesterday, Mr. President, you said that they were for, quote, immediate delivery. Immediate, we heard from
We're ordering, yes, we have millions of units ordered. Bayer is one of the companies, as you know, big company, very big, very great company. Millions of units are ordered, and we're going to see what happens. We're going to be talking to the governors about it, and the FDA is working on it right now. The advantage is that it has been prescribed for a totally different problem, but it has been described for many years, and everybody knows the levels of the negatives and the positives. But I will say that I am a man that comes from a very positive school when it comes to, in particular, one of these drugs, and we'll see how it works out, Peter. I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. But we have ordered
This is silly.
millions of units. It's being ordered from Bayer, and there is another couple of companies also that do it.
For clarity, Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree. I guess on this issue,
Well,
then
I think we only disagree a little bit.
I'm sorry.
Well,
Maybe and maybe not. Maybe there is, maybe there isn't. We have to see. We're going to know.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Misrepresenting
I
the
don't-
preparedness right now?
No, I don't think so. I think that, it's got, no, I know.
The not yet approved drug.
Such a lovely question. It may work and it may not
such a
work.
lovely question.
And I agree with the doctor, what he said. May work, may not work. I feel good about it. That's all it is, just a feeling. smart guy. I feel good about it. And we're going to see. You're going to see soon enough.
Oh,
and we have
gosh.
certainly some very big samples of people. If you look at the people, you have a lot of people that are in big trouble. And
A lot
this
of
is
people,
not a
big
drug
trouble.
That obviously, I think I can speak for from a lot of experience because it's been out there for over 20 years. So it's not a drug that you have a huge amount of danger with. It's not like a brand new drug that's been just created that may have an unbelievable monumental effect, like kill you. We're going to know very soon. And I can tell you, the FDA is working very hard to get it out. Right now, in terms of malaria, if you want it, you can have a prescription. You get a prescription. And by the way, and it's very effective. It works. I have a feeling you may, and I'm not being overly optimistic or pessimistic. I sure as hell think we ought to give it a try. I mean, there's been some interesting things happened and some good, very good things. Let's see what happens. We have nothing to lose. You know the expression? What the hell do you have to lose? Okay?
So what do you say to Americans are nearly
I'm sorry. Like, okay, so I gotta stop here for a second because, like, in order to like sell to like if I'm sitting like sell to someone, if I'm sitting here thinking to myself, what's gonna convince me that someone gives you a potential thing to alleviate a problem. That's essentially what this question is. We have like this drug that's an anti-malarial and it could help potentially to stave off symptoms associated with COVID-19. Probably not going to work. There's no evidence to suggest it would. So if I were to listen to somebody say, well, yeah, I mean, we're going to give it a shot anyways, just like we'd give anything a shot. Okay, cool. You do not need to say that you are hopeful that it will work. Okay, this isn't a time to be giving people false hopes about something that may or may, like, you've got your actual staff doctor who was just up on stage saying, I wouldn't really put much stock in that at all. Or I wouldn't make any of those connections. He's saying that to the journalist, and then Trump basically comes up and says, well, I'm optimistic. And he's essentially disagreeing with his expert that he just had up there. So this is like, you know, I'm going to keep this going for a little bit because it really just gets more absurd.
John, go ahead. 200 dead. What do you say the Americans were scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism and
all he did was ask, what are you going to say to American people who are scared right now? Because there are people, like there are Americans that are scared right now. That's just a thing that's happening. So that's a hilarious response. I don't know why I frankly don't understand why he's making a pivot to the corrupt media here. I don't get it. Because I just don't, I mean, maybe he's just trying to kind of wash some of the blame off himself, I guess, or dust it off. I'm not really sure, but this is, you know, let's.
the same with NBC and Comcast. I don't call it Comcast. I call it Concast. Let me just ask.
Okay, yeah. See, like that's dangerous, man. That's like anybody can talk to me and they know that I'm not a huge fan of Comcast. While they're essentially they are the ones that provide the connection that makes this stream currently possible. I pay them more than I think I should, and which I frankly think it should be zero. I think we need to be, especially in the climate right now, I think we need free internet. But for the president to be doing this, like, it's one thing for me to be some goober sitting in a room on the internet talking about this. It's really one thing for me to say or do that. It's another thing for the president of the United States to do that, okay? Like, those are two completely different things. Like, yeah. So I don't call it Comcast, I call it Concast. Great. Cool. Let's keep going.
For whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.
Can I get back to the science and the logistics?
You ought to be
here?
ashamed of yourself.
The units that were ordered, are they for clinical trials or are they for distribution to the general patient population?
We are going to, as I understand it, we are going to be taking samples in New York. Governor Cuomo very much is interested in this drug, and they are going to work on it also after they get a certain approval. We're waiting for one final approval from the FDA. We'll see what happens. But we'll use it on people that are not doing great, or even at the beginning of not feeling
Sort
well.
of fall under the
And John, what do we have to
modified
lose?
auspices. So this would sort of-
Wait, John, it's been out there for so long. We hear good things. Let's see. Maybe it works and maybe it doesn't.
I understand all that. I'm just thinking of the application here. So that would be under sort of a modified compassionate access?
We're doing that, I guess, and that's what it's called, yeah. Yes.
I would like Dr. Fauci, if you don't mind, to follow up on what the president is saying. Should Americans have hope in this drug right now? And sir, I would like to follow up on Peter's question here. Could you please address Americans in this country who are scared right now? This is a very valid concern that people have.
No, there really isn't that much of a difference in many respects with what we're saying. The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective, but as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might.
This is incredible to watch. The way he's now, this is what's up with this administration in real time, and you can watch it right here. As you know, he's now coming back in and trying to really circle the wagons around this and say, no, we're not saying anything drastically different, and in a technical sense, that's true, okay? That's the thing about it. In a technical sense, that's true. However, the emphasis placed, it's like, I mean, it's not dog whistling, but it's, you know, it's like using, if you use certain language with certain people, you can communicate how you identify. That's a really good example is in religious conversation, or you know, if you're listening to radio, it's pretty easy to glean through the language somebody uses if they identify as Christian. That's a very broad tent, but you know, as particularly like evangelicals, there's language like that you can use that will signal to folks this is what this person means. And what Fauci's original response is doing is he's really kind of, his language is suggesting that we should his language is suggesting that we should err on the side of caution. And when Trump gets up, he's giving this vibe like, oh no, it's like we can be really, you know, I'm optimistic, which none of these are absolutes, but this is the thing that you'll run into when you're dealing with politics like this, is that there's no absolutes. There's never absolutes at all. Not even close. It's always about the way they spin it, and it's pretty gross that that's what's happening currently right now with this entire situation. So I'll let Fauci finish here, and then we'll cut this off.
Might work. You're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason to believe it's not safe?
Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the toxicities are rare and they are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe, but I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
I agree.
Sir, your message to Americans who are working at home, who have their children in their homes right now, who are
Here we go. Go
homeschooling,
ahead.
doctors who say they don't have the masks they need to do their jobs, your message to them.
My message to the American people is that there is a very low incidence of death. You understand that. And we're going to come through this stronger than ever before. If you get it, if you happen to get it, it is highly unlikely. It's looking like it's getting to a number that's much smaller than people originally thought in terms of the ultimate problem, which would be death. My message to the American people is, number one, you've done an incredible job. Incredible what you've gone through. It's been incredible. It wasn't their fault. It wasn't their fault. It wasn't the fault of 140 other countries where this has happened. And there is tremendous hope. And I think we're going to come out stronger, better, bigger in every way. I think we're going to be a better country than we were before. And we learned a lot. We learned on reliance, who to rely on, who not to rely on. But our country has been incredible, the way they pulled together, including the fact that I just spoke to Senator Schumer. We had a wonderful conversation. We both want to get to a good solution. But it's been really, for me, watching and seeing people that weren't speaking, getting along well, because we all have one common aim, and that's to get rid of this invisible enemy, get rid of it fast, and then go back to the kind of economy that we had, and maybe even better. Yeah, please, in the back. No, in the back, please.
Mr. President, I have two questions, if you'll indulge me. The first question is, many small...
So, I mean, like, you know, the way he talks about this is it's like it's already over. Or that, you know, that we're on the backside of it, and it's just, that's just not the truth. I'm sorry, man. Like, I'm not out here to try and freak people out, but, you know, this is bad. And this sucks for everybody. And if you're not grappling with that, then I'm sorry. I don't know what to tell you, but it's only going to get worse. And I hate to be like bumming on this every day, and I'm gonna, as I do this, I'll try and find more happy stuff. I mean, some of this was funny, for sure. At least I think it's kind of funny, but it sucks, man. It really sucks that this is where we're at with this guy right here. So I don't know. It's, you know, it's pretty wild. And just for just sort of like for posterity's sake here, there's some video. There was one specific let's see here. There's one that I had seen. Looks like there's a video going up by Sky News right now. It's kind of, if you go and search, this is something that's kind of popping off right now. And I just want to show this for just sort of for effect, because I think I want to have something to contrast. Trump's like, oh yeah, we'll be all right. We're working on it. We're gonna, you know, I'm really impressed with our solidarity and how we're coming together. And cool. I think a lot of people are. That's fine. That doesn't mean that stuff like this goes away. So sorry for the graphic content.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying. This isn't an intensive care unit, it's an emergency ward. The ICU is full. People have only just arrived here and they're in terrible shape. This is an absolute constant. This killer pandemic is virtually out of control. The patients are literally gasping for air. The plastic bubbles the staff struggle to communicate through attempt to equalise the air pressure in the lungs. Nobody expected this. Nobody thought they'd be treating so many so quickly. And it's not like flu. It is chronic pneumonia, and it is killing hundreds each day.
There are now 15 patients.
The doctors say they've seen nothing like it before and are warning other countries, especially the United Kingdom, that they will see it as well.
People who keep describing this as like flu. It's worse than that, no?
No, it's totally another thing. I think it's most pneumonia, more pneumonia than flu. Mm-hmm. Because most people get pneumonia. And as I said before, it's a very severe pneumonia. And so it's a massive strength for every health system, because we see every day 50 to 60 patients who come to our emergency department with pneumonia, and most of them are so severe they need very high FiO2 of oxygen. And so we have to reorganize our emergency room and our hospital in 3 levels of intensity, as you saw.
This is the main hospital in Bergamo, in Lombardy province. It's one of the most advanced hospitals in Europe. But it's the most hard hit of all the hospitals in Italy. The town is the centre of the epidemic here. This isn't a ward, this is a waiting room. Wherever you go, people are on gurneys, in corridors, in meeting rooms, they're everywhere. All the medical staff urge other nations to see what's happening and lock their nations down right now or face this.
What I would suggest is just shut down to stop all the outbreak and not come in this kind of situation that is very, very difficult to manage.
Can I ask you personally what it's been like?
I never felt so stressed in my life. I'm an intensivist, and I'm quite used to, intense moment and choices, and people are critical and will die without any, treatment, and you make the difference. But when you arrive at this point, you realize that you are not enough, and maybe we are 100 anesthetists here. We are doing our best, but maybe it's not enough.
We are performing the test for the nasal swab to detect coronavirus.
The problem facing health services across the world is that when the infection curve goes up, it rockets. And all the resources, all the testing, all the supplies are used up instantly. Multiple hospitals all at once.
What's staggering is that Italy is doing a lot of testing. Thousands upon thousands are being tested. So far, about 4,000, the numbers keep changing, have actually completely recovered. The crucial point is that about the same number are dying. They're sort of neck and neck. And it seems you either live and recover or you die. Something nobody expected.
What? Wait.
Bergamo.
You either live or you die. Something nobody expected. I don't know what's up with this journalist, but that was just a really useless observation in my opinion. This is like, forget whatever goon decided that that was the way he needed to talk. I mean, we can't see him because he's totally decked out. But yeah, I mean, the main thing here is that this is what it looks like. And Italy had about as good, if not worse, or not better than of a response than we did. They're roughly equal. I don't care what anybody says. I mean, right now we are dealing with so many problems with the test in terms of, I'm sitting here trying to deliver this information. Okay, I get up, I'm like doing my best every day when I get up in the morning. I mean, it's a solo thing, and I have a million other things that I got to do around the house too, because I'm sure everybody is aware that, this is we now all are suddenly super responsible for a whole lot more all at once. We have to do all of our day job stuff at home while we're also trying to do all of our home stuff, because being at home means all of these demands are suddenly on you. I'm trying really hard to sort out like particularly when it comes to the testing. Like I've been trying to track this a lot, and it's tough to say exactly what's going on with it all the time, because I see different people talking about different stuff. Well, the CDC is having problems, and we're not necessarily taking the test from the World Health Organization, but they are also trying to send tests from other countries to here because we're having problems. It's like there's a lot of stuff, and I'm having a hard time aggregating it all on my own, just solo. So it's tough for me to get a solid read on that. But what's important to understand is this is what that scale is. This is the scale of that problem over there. And, when you got Elon Musk talking about how panicking over this is dumb a little while ago, and then saying, oh, well, if we need more respirators, we'll just make them. And it's kind of like, well, dude, I mean, I'm watching that footage, and I think we need more respirators. I was hearing that there's, something like 20,000 respirators, and it's like, hey, dude, if you don't think that millions are going to get this, 20,000 respirators isn't going to do a whole lot. And they're a huge chunk of change. Hospitals are not buying that equipment right now because it's so expensive. Okay, the shortages on stuff are for dumb monetary reasons for the most part, or just, understaffed stuff. It's like a lot of these issues are directly result of a crony capitalist system run amok. It's like, I don't know what to do about it. I don't know how we deal with this. I know that's probably going to sound like a lot of opinion, but I've heard everybody from every part of the political spectrum, express that that's the issue that they see it being. I think everybody's on the same page about that. It's just, this is what it is. And, I just don't think it's possible to stress how important this stuff is. And then, it's like, so here's Trump. He's out here spending this time where he could be consoling people who are freaking out, yelling at the reporter who asked that question. I mean, even now, Twitter is exploding over this whole thing, and you got like a bunch of news pundits talking about how it's BS, and cool. So that's happening there. I don't know where Joe Biden's at on this right now. Let's see if he's, has had anything to say today. I know, this is, let's see. I just pulled up his Twitter. I mean, there's a lot of there's a thing going on about stock buybacks right now. and how everybody is sort of asking folks to not participate in stock buybacks. It's, obviously, given this situation, if you're a business owner and you do a stock buyback, I mean, it's like, that's just evil to do right now. That money needs to be going to your workers. You should, I mean, all the money should be going to the workers at this point. This is ridiculous. This is not a time for anybody at the top to be trying to cut profit. I think that's ridiculous, personally. Labor is going to save us in all this. From people that are going to sacrifice themselves, just putting themselves out on the front line to do that work, and knowing that they're going to get that virus, non-essential, or, well, I guess, there's non-essential work that still sort of needs to be done, or maybe essential in a completely different way. So that's something to keep in mind. But the idea that a corporation would do a stock buyback at this time, board members and shareholders doing that kind of thing, that's just gross. So, that's basically, that's all Joe Biden's talked about today. He wants to provide a $15 minimum wage, paid sick leave, and strong workplace protections. I mean, this is this is it, okay, folks. I'll put it up right here. I'll put this tweet up right now. Look at this goober, okay? We'll make this a little bit bigger. I mean, this is what he's got? That's it? Come on, dude. We're in a way, 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 way worse situation than that. I mean, 15 minutes. Why are you talking about a $15 minimum wage when people can't even go to work at all? Right? I had been hunting for a job up until this point. I cannot anymore. I just can't. I can't go and look for work at this point because there's none to be had. All the jobs that I know that I would go and try and get right now, nobody's going to hire me for them. And even if I were to go for them, they would be putting me at risk, and I'm around people who are high risk. So therefore, in a sense, I'm high risk. I have high risk factors in my own life that make it not acceptable for me to go and take high risk work at this time. Okay. And that's just, that's a limit that I have to know about myself. And I think everybody needs to take those limitations for themselves into account when we're dealing with this right now, and also not, get mad or hold people accountable or blame anyone when they can't go and do that essential work, or they might not be able to do that. So yeah, it's, that's the leading Democrat guy. That's the guy that they want to put up against Biden right now. Silly. Utterly silly. Just, I don't know what to do with that. I really do not know. I don't. So, anywho, last thing I wanted to cover. This is something that everybody's kind of talking about a lot right now, and I think it's good that we just sort of go over this. There's going to be a lot more about this in the coming days and weeks I know that I'm talking to some people about trying to get some content specifically developed for this. So right here we have how to make a homemade face mask if you absolutely have to. And the important thing is that, you know, if you're good at sewing or crafting, anything like that, your skills are like, they're super, super needed right now. Super, super needed. This is top shelf stuff. So crucial. Obviously, not everybody's going to be able to get their hands on a surgical mask. And here we can see that a surgical mask would give you 90% protection, which is like fairly high. Not the same thing as like as the N95 masks, which if you have those, please consider giving them to the hospital and not keeping them for yourself and trying to do something like this instead. I'm sorry. They need it worse. You don't need it. There are some that I have here at my house, and I would give them to them if they weren't covered in lead. At any rate, if you don't have surgical masks, next best thing you can use is a vacuum cleaner bag. That material is incredibly protective at 86% coverage. Next step down, you have tea towel at 72%, which is pretty all right. Definitely better than nothing. Cotton mix is about the same at 70%, and antimicrobial pillowcase around 69. So at that point, it's like, if you've got bandanas, even putting a bandana over your face is not only going to help things coming at you, but it also is going to be protection from touching your face. I mean, I sit here and I'm doing this stream and I'm like touching my face the whole time. And the only reason I feel comfortable with doing that is because as soon as this is over, I washed my hands before the stream. As soon as I'm done, I'm going to wash my hands again. And then I'm going to do it again before I leave the house and all that stuff. So it's like, and when I say leave the house, I mean like to get in my car and then go nowhere and then come back to my house and not, you know, like, if you got to monitor every single thing that you touch and every single thing that you do. And it's just, you know, I did stop by the store earlier. There were some gloves out, which I thought was pretty cool. When I was going over to the bulk section to get some bulk stuff. And yeah, that was really nice to see that there were some gloves on hand to help protect against that transmission. And again, it's important to remember that it stays alive on plastic for, I think it was up to 3 days, according to Harvard Health. So that all your bags and stuff, you just, be careful. Be careful. And again, you know, if you've got stuff coming in the mail, make sure to open it up outside. The virus is going to last 24 hours on that cardboard. So if you've had a driver who's had exposure, they could be leaving it on that package and then you're bringing it into your house, and and you don't know how you got it. It's just what happens. So that's really important to keep in mind. You know, cotton t-shirt, obviously not going to help you very much. But again, 50%, 50% is better than nothing. Again, you got to keep it all in perspective. That's the best thing I can say about it, is you got to keep it all in perspective. So, sorry it wasn't as fun today, folks. I'll try and pull up some funnier stuff next time. I mean, it's been a little bit tricky, obviously. I will encourage folks. I did a live DJ set last night on Facebook. That video is still up, so you can go catch it. I don't think anybody's taken it down yet, which is kind of cool. I'm sure somebody will get mad about, you know, copyright or whatever at some point. But until that happens, free hour mix on my Facebook page and my personal Facebook page, and that's actually That's actually public. Most of my stuff is private, just because I just don't want to broadcast it out. If you're friends with me, obviously you can see everything, but that video everybody should be able to get at. And I'll do more with it. I was speaking to Charlie Chronopoulos earlier today, trying to help him out. I think, or well, just give him some, information on how I'm doing it, and hopefully he'll be able to improve his setup. And I want to, again, help other folks with this. I did have there's a stream that got forwarded to me earlier this morning that was how to do crafts at home. I will link to that page as well. Try and get a link up to that page. I've been recording this episode, so I will get it up on YouTube after this. So it'll be over there for posterity, which is always nice. But I'm trying to think if we have any more updates at this point. Oh, I think that just about does it. Yeah. Suppose I should check the chat really quick, see if anybody... Nope. I haven't had anybody weigh in today, so that's okay. No big deal there. I'm happy to close it off now. Yeah. So thanks, folks, for thanks for anybody who did tune in today to catch this. Thanks to anybody who's watching it after the fact. I hope there was some information in here that was helpful. I hope we could have a chuckle at some of the absurdity of Washington politics, and also have a better grip on what's happening with that. And yeah, we'll have more updates on art streams and stuff like that. I'm gonna try and get some more stuff aggregated in and shared out for folks. Still working on centralizing things, so we'll get there. We'll get there. There's a lot of new stuff popping up, and it's just a crazy time. It's a crazy time to be making stuff. So, alrighty. I think that about does it for today's stream. I want to, thanks for tuning in. Hit us up on our Patreon. Patreon.com/ForagerNH. @ForagerNH on Twitter. You can head over to our YouTube, subscribe to us there. Definitely please consider supporting this. Gonna keep doing it. Really hope that this is just this can become a resource for folks, and we'll just keep rolling. We'll just keep with the updates, and when I come back next week, I hope to have some guests on. So, and we'll get better at giving everybody notice this is going to be happening, and making announcements that we'll be back, and when we'll be doing the stream. We'll try and create a better schedule around this. So that's the goal. That's the goal. And it's been pretty real, folks. I've had a great time hanging today, and I look forward to seeing everybody soon. So take care, and we'll catch you next week.